Tendonitis. How would you describe it to somebody?
Okay, perfect. So actually, tendonitis is a bit of an outdated term at this stage. We tend to refer to it as tendinopathy now.
Okay.
And the reason for that is because itis, the ITIS part of it, denotes inflammation, and not all tendon problems have inflammatory components. A lot of them, such as the tennis elbow, which you mentioned in your questions, is actually a tendinopathy where you get a degenerative component in the tendon rather than an inflammation. So it's a degeneration of the tendon. So the terminology has moved on to make it more accurate, and now we describe it as a tendinopathy.
Or what is carpal tunnel?
So carpal tunnel is quite different, actually. So carpal tunnel syndrome is basically where you get a nerve entrapment in the wrist. So at the front of the wrist, if you're looking at your hands with the palms facing up, the wrist where you see the little creases there, you have an area there called a carpal tunnel, and it's a bony canal, and it's formed by the little wrist bones, the carpal bones, on three sides of that canal, and then you have a ligament over the top. So it's quite narrow, it's quite inflexible, and you have a nerve that passes through that tunnel called the median nerve. So it's one of the three major branches of nerves that pass down through the arm. So carpal tunnel syndrome is where the median nerve passing through the carpal tunnel becomes compressed. And that can happen for lots of different reasons, but I guess from a musician's point of view, it happens because of repetitive motion, forceful repetitive hand movement.
What causes tendonicity or carpal tunnel?
Yeah, so basically a tendinopathy is a repetitive overuse injury. So overuse is the key word here. So again, in musicians, you're looking at long hours of practicing, you're looking at probably long hours of performances then. You might be practicing an awful lot, you might be very tired, you might be stressed because the performance is coming up, but you have to keep practicing because obviously you have to be on point for your performance. So the difficulty with that is that you keep putting the tendons under this pressure, and potentially as you're coming up to your deadline, you don't have as much time for recovery. You might not be paying more attention to stretching or trying to make sure that you give yourself frequent breaks if you're under pressure with a deadline. So tendinopathy happens as a result of overuse. With carpal tunnel, again, it's the repetitive, forceful movement that causes it, but it's a different mechanism of injury because you get this irritation, this swelling potentially in this inflexible area of the carpal tunnel at the wrist, so you get the compression of the nerve. So the pain is caused from two different sources.
How can one prevent tendinosity and carpal tunnel?
So the most important thing is to try and build recovery into the movement that you have to do. So again, as a musician, you need to be making sure that you schedule in regular breaks. You need to take, they don't have to be long breaks, but short breaks in this repetitive practice involving, your arm and your hands. You need to make sure that you're paying attention to trying to take the pressure off your elbows, take the pressure off your shoulders, even up into your neck. Sometimes you can have an impact from your neck that manifests down in the elbow as a tendinopathy or manifests down in your carpal tunnel, because this median nerve, that's the problem in the carpal tunnel, comes from your neck. So frequent breaks, frequent changes in position, but short breaks, not long breaks, as I say, but trying to build recovery into your session so that when you finish a particular period of time of practice, you're stretching, you're undoing. Like you see an athlete do their stretching after they played a match, you should be doing the same thing as a musician. You should be preparing your body for what you're about to do in practice or before a performance, and then you should be stretching and helping to recover after you finish the performance or the practice. You need to also think about other things like sleep. So again, if you're under pressure trying to train or trying to practice for a big performance, you might be anxious about the performance, you mightn't be sleeping very well. So sleep deprivation can aggravate the pain in these types of symptoms. So you need to make sure that your sleep is good. You also need to watch, with carpal tunnel in particular, you need to make sure you avoid sleeping on your hands. You need to make sure you avoid sleeping with your wrists bent. So that, again, if the wrist is bent, think about if your wrist is palm facing up and you bend that wrist towards you, that closes down that carpal tunnel. If you like to sleep with your wrist in a bent position, everybody has lots of different positions that they like. If your hand is under the pillow and it's forward bent and your head is on it, for example, you could be compressing that nerve for 6, 7, 8 hours per night. And that, even by itself, could cause pressure on the median nerve. So good sleeping hygiene, so sleeping in a good, natural, balanced position. If you have a tendency to bend your wrist or sleep on your hands, you might need to consider a splint to keep your wrist in a neutral position. to reduce the symptoms then.
What is the treatment for these, and how long does it roughly take to recover from it?
It depends. So the most important thing is to recognize the symptoms, because the earlier you recognize the symptoms, the quicker you can take action. So typical symptoms for carpal tunnel, say, would include tingling and numbness and burning pain. So you could get that in the wrist, in the hand, or into your fingers. Sometimes it can even go up the arm into your shoulder. In very chronic cases, you might start to lose fine dexterous control of your hands and your fingers. You might feel clumsy and weak through the hands. But the median nerve, it gives sensation to your thumb, to your index finger, to your middle finger, and then to half of your ring finger. So the thumb half of your ring finger. And it's responsible for the movement of the muscles at the base of your thumb, which are called the thenar eminence muscles. So again, if you recognize those symptoms early, that's part of, that's really, really important part of the treatment, because a lot of times these things, they'll niggle, you'll be able to shake them out a little bit, and you'll find that you have them when you look back for many weeks or many months before they get to a point where they start to stop you doing things, or they start to cause weakness in the hand, or this clumsiness that I discussed. So the first part of treatment is to early recognize your symptoms. Once you do recognize them, then, again, you need to make sure that there's nothing coming from your neck. So, a chartered physiotherapist who's used to dealing with repetitive strain injuries, because it falls under that group, or an occupational overuse injury, again, it falls under those umbrella terms. So you need somebody who's used to dealing with those. So your neck needs to be cleared, and make sure that there's nothing coming from the neck that's causing this problem. You need to make sure your shoulder, your elbow movements are clear, your wrist movements. But then you need to really reduce the symptoms, so this pain, this burning. So the first thing we would typically do is get somebody into a splint to try and make sure that their sleeping patterns are not aggravating the problem. And then, depending on what we find when we examine your neck and your upper limb, we would direct the treatment there. Again, we would look at the position that you're in, depending on the instrument that you play, and again, just see, is there something from that position that you're in that's predisposing you to this, and then what changes can we make to get you into these recovery positions when you can take breaks in your session.
Is it possible to recover 100%?
I mean, in theory, yes, if you take the stress away and you build up strength around it. But if you've left it for a long time, the problem with a nerve injury is it can be very slow to heal. So if you allow that to go on for months or even years, then you have less chance of clearing it fully. So the quicker you deal with it, the better. Certainly with a nerve entrapment. But in most cases, it will settle down. Now, if it's not settling through conservative means, there is always an option. You'd obviously go down the route then of pain medication, trying to reduce the inflammation in the carpal tunnel itself. So you may have to visit your GP to get some prescription medication to reduce that, anti-inflammatory meds. Then you potentially might even head for surgery. That can help greatly in very persistent cases. But again, it would be a small number of people that would progress that far, because usually the conservative treatment works in many cases.
And if I overlooked all these steps and symptoms, what is the worst case scenario that could happen to a patient that is really being silly and not looking up the professional help from somebody? What is the worst case scenario that could happen?
The worst thing is that your pain will spread throughout your whole arm. It will go up into your neck. You'll start to lose your dexterity. So as a musician, that's a disaster, because you need to be very, very specific and very precise. So if you start to get clumsy and weak through your hand, and then you start to miss notes, that's going to really affect your performance. So that's, the weakness, that change in sensation that happens as a result of a nerve injury, that's the biggest problem, I guess, your worst case scenario for a musician. As regards the overuse, then that would be a little bit different. The pain pattern is going to be different with an overuse injury. But again, early recognition is key. So the earlier you can take the pressure off this tendon so it doesn't continue to degenerate, the better. So what you're looking at is what has caused this problem. Have you got weakness in your forearm muscles? Have you got weakness potentially around your shoulder blade stabilizing muscles? And again, could this be coming from your neck? Could this be a neural issue that's putting pressure through the tendon in that area of your elbow? So again, your chartered physio would look at those things and determine why this problem has happened. But the quicker you can deal with it, the less compensation you will have developed as a result of it. As a worst case scenario for your overuse, again, that tends to get very, very painful, to the point where you might have difficulty gripping. So, if you're trying to hold on to your guitar, for example, the gripping action might be a problem. If you're trying to use your fingers, again, if you think about when you use your fingers, the muscles that are working in your forearm, they attach right up at your elbow where the tennis elbow pain happens. So any gentle use of the fingers on an instrument is going to bring on that pain straight away. So you'll start to get change in your changes in your pain pattern so that the pain will come on easier and quicker. The threshold of pain will become lower, and that's your problem with an overuse injury.
Those are brilliant answers. Brilliant answers. Thank you so much for those. Now, what treatments and services does Total Physio provide on a daily basis?
Okay, so Total Physio is a private physiotherapy practice, as you know, you called in. So we're a spine and sports injury clinic. So basically, we treat a myriad of issues. So in the area that we're in, we have a lot of people who have repetitive strain injury because we're looking at people who are working in offices around the Sandyford area. We see a lot of sports injuries. So again, lots of runners, lots of triathletes, lots of people out cycling, and again, just people going to the gym. So we would typically see musculoskeletal issues in those patients. We teach clinical Pilates and strength and conditioning classes. They're all taught by chartered physiotherapists. We have a running analysis lab where we have a treadmill set up and we video patients with persistent running injury. So we look at how they run from the side, from the back, and we look at why their problems are persisting and haven't been maybe solved by a traditional rehabilitation program. We do personal performance planning, which again is somebody who goes to the gym and may not know how to use the equipment or how they need to build their bodies up based on the goals that they have. So we'll bring them in and we'll work with them in our Pilates studio and we'll try and determine how we can get them to where they need to go through exercise, flexibility, mobility, that type of thing. And then our latest service is a cancer rehab service where we have patients who are going through either waiting for cancer treatment, going through treatment, or in the post-treatment phase where fatigue can play a big role, where we look at how we maintain their body strength because weakness and fatigue is a huge part of the cancer journey for people. So we're trying to help people to build up their stamina and their endurance and their strength in that regard. So that's our latest service that we're quite excited about.
What inspired you and motivated you to become a specialist at this particular field?
Well, I was always interested in sports physiotherapy. So when I was younger, I used to watch the physio run out on the rugby pitch and think, oh, that's what I like. Well, that's what I would like to do. I used to watch footballers and I'd see them go down injured and I'd be interested in what was going on. So I did my master's in sports and exercise medicine in Trinity after I did my basic undergrad. So sports medicine was where that's where I wanted to go. So I ended up working in private practice, but also I worked with the FAI for many years. And I was physiotherapist with the Irish women's national team for many years, traveling with them and basically being there for all their training sessions, all their matches. So I was the sideline physio looking after them and then liaising back with their clubs when they went back after we had been in camp. So sports was always what I really loved. But again, sports and musculoskeletal, there's a huge overlap. So now that I'm not working with the FAI anymore, again, so many people are trying to stay fit and active and healthy these days. So actually there's a huge overlap. So the musculoskeletal is kind of where I've gradually just moved into since the sport.
You sound extremely passionate about your profession. That's fantastic. I'm very happy to hear that. What is it that you like about your profession the most?
I think I like the variety. So there's plenty of people that come in. Everybody has a different story. You know, you're a musician. I'll see somebody else who likes to run up and down mountains every weekend. You know, everybody comes in and they have a different passion for what they like. And if I can help them do the thing that they love to do, I find that really rewarding.
Jenny, thank you so much for your answers. You know, you've been a great help to us. Your answers are brilliant.